Therapy is not for crazy people.
Oh, it's not.
No.
Because I always thought it was.
Back in the days, it started that way. Back in the days, it was for the insane. Therapy has progressed, and we've realized that your mental health checkup is as important as your physical health checkup. So if you can go eat you can go to Air One and eat all the healthy organic food, go to Equinox and work out 12 times a day or whatever, whatever. But if you're not mentally disciplined, if you're not taking care of yourself mentally and you're just depressed, scrolling on, you know what I mean? You're not going to have a good life because everything starts from here. This controls everything.
How do you do a mental checkup?
You go to a therapist and you have them do a psychological evaluation on you. And they see how you're doing. We have assessments.
Do that live?
I would have to send you the GAD and
Do
the PCL
you really
and
want to do this shit
PHQ-9.
live?
Of course I do. Why not? You don't want to do it?
I'm down to do it. Sure.
I
I'm down
wouldn't
to do it.
do that
It
on
doesn't have to
live.
be.
Why
I was going to say
not?
live TV. I wouldn't. No, that's your personal information. Let's not do that.
So how can we?
You know,
that?
You go to a
you're
therapist?
episode 302, right?
Yeah, listen.
All right. Just want to throw
We'll
it out.
do-
Any type
Your
of
666 episode, we'll go ahead.
not even a basic analysis
Listen,
or
everybody has some level of issues, okay? And in the DSM, the Diagnostic Statistical Manual, that is our holy Bible of what we diagnose out of. So every single person has a level of depression, anxiety, all that fun stuff that we talk about quite
Absolutely.
often. Even a level of narcissism, okay? Your narcissism can actually get you to very high places in your life. You are not a narcissist. You don't have narcissistic personality disorder.
Can we just
Okay,
call
there's
it?
a
Can
difference.
we call it an ego instead of narcissism? Because ego sounds so much more better than
That's fine, but everybody has a level of narcissism. There's a healthy level of
think
narcissism.
Natalie
Actually, you guys have a healthy level of narcissism. You're sitting here chit-chatting about stuff. You have a lot of confidence in yourself to talk about things, and people could say a bunch of stuff, and you're just like, you know what, this is what we do. I trust what I'm doing. I'm moving forward. That's your healthy level of narcissism. That's your ego.
so
good.
what method do you use? Because for me, I'm sure you've
For diagnosing?
no. As far as I don't know if you've heard me mention this over the many episodes, where I think the most important skill an individual can develop throughout life is how to process things in life. I'd like to know whether you agree or disagree with that, and if so, either way, what methods or tools do you use for that?
Well, that's a very loaded question. So first of all, when you're saying process things in life, like psychologically process or emotionally process?
Depending on the situation. Yeah.
So different therapists work in different ways. First of all, I want to just for a minute backtrack as to what we were saying with the whole analysis thing, how to do a mental health checkup. You go to a therapist, they do a psych evaluation on you. They ask you a bunch of questions to get to know you, and they, you can just see like where your strengths are, where your growth areas are. That's a politically correct way of saying it, basically, instead of weaknesses. But there's also certain assessments we can give you, like the GAD, which is a generalized anxiety disorder assessment. There's a PCL for trauma and PHQ-9 for depression. Anyways, depending on what you score, you get diagnosed with whatever it is or not. So you can have a level of depression, anxiety, and all the fun stuff that we all feel. But if it's not affecting your social and occupational life functioning, then you're not going to be diagnosed with it most likely, because that's the main thing. Your symptoms have to be clinically affecting you. So you can't go to work, you can't have relationships, you're not sleeping, you're not eating, you're not functioning, you're not able to function. It affects your daily functioning. That's considered a significantly...
But what's the difference between when you said, is it processing psychological or emotional?
So
What's the difference
processing
between the two?
psychologically is like you hear someone say something, right? So cognitive behavioral therapy usually talks about this, and nobody can ever say whether it's the feeling that comes first or the thinking, or is it the thinking and then the feeling. You can go either way, whatever it is. But someone says something to you. Are you responding or are you reacting to it? In therapy, we're teaching patients how to respond rather than react. Okay. Mm-hmm. So psychologically, if I was to be sitting here and you guys say, women suck, Okay.
We'd
Simple
never
thing.
say that.
I'm
Sure.
just saying, okay? So women suck. Okay. Psychologically, I go like, not really. Not a women suck. I don't suck. You know, like I'm a pretty awesome woman. You know, I could think that to myself because I know myself, right? And emotionally, I'm like, that's not true. You know, like I'm pretty good. Like, but if I'm not emotionally well, I could take that personal. Not all women suck, and we can be very
defending
active at
yourself.
yes. And that's called generalization.